first of all, thank you to Congressman Burgess for allowing us the opportunity to be here. I'm particularly happy to be here. I think primarily because we're talking about a topic that is so close to my heart, and that's the practice of medicine. I'm not going to talk to you about cost. I'm going to talk to you about two things that the previous speakers have already focused on, and I think is particularly important to keep them in mind. Number one, quite frankly, is quality. Quality is the name of the game, and I'll outline this for you in a minute. Secondarily, it's personal accountability and responsibility. At the end of the day, what is right and what is wrong about our system is easily remediable, but it's not going to happen overnight because we've created a process where, unfortunately, we look to someone else to solve the problem for us rather than solving it ourselves. And I'll highlight what I mean for you in a minute. Secondarily, it's not what you pay for something, it's the quality. So at the end of the day, if I have to do 2 procedures to correct something that didn't happen the first time around, am I spending more money? Yes. Am I creating a problem for a patient? Yes. Do I want to do that? No. Does it sometimes happen? Yes. So what's the name of the game? Quality. Get the best possible result. And even before that, what do you want to do? You want to make sure that people don't have the clinical illness. Decrease the clinical burden. So I'm going to take a step back because I've just laid a bunch of concepts out to you that I think are really, really important. First of all, do I think our system works? Yeah, I do. Why do I say that? Because we absolutely have got the best system of medicine anywhere in the world, period, and discussion from my perspective as a physician. Now, why do I say that? Because we know how to take care of sick people really, really well. So if I have a heart attack, I don't want to be anywhere other than where I am right now. If I need a heart transplant, I want to be right here. Heaven forbid if I ended up with cancer, I'd want to be right here. But guess what? What if I had had a preventive measure done earlier? And that stage 4 cancer got treated when it was a stage 1 or maybe even prevented. What if I actually adhered and took my cholesterol medications and exercised properly, even though I had a stacked family history? What if I did that and I never developed the heart disease, or I got it at age 80 instead of at age 40? Do you think that would impact the amount of money we spend on healthcare? At the end of the day, you know the answer to that. Now, why don't I do that? Why don't I engage myself? Because I'm a human being. That's why. It's not relevant to me when I look around the room and I look at most of the people in the room. You're a little younger than I am. Most of the people there in the room, it's not relevant to you today because what I'm talking to you about is illness that's going to develop for you 10, 15, 20, 30 years from today. You know what? My father-in-law is a retired pharmacist. He put it to me very easily. He's from Texas, by the way, Congressman. He put it to me very easily. He said, you're giving people information that's not relevant to them. Say it a different way. We haven't connected with people so that people start to understand that the driver in their healthcare is themselves. Okay? The driver in their healthcare is themselves. So, think about where we are today as a healthcare delivery system. We know how to look after people really, really well. The medical system has really taught me to be a great person to bail water out of a rowboat. Okay, we've got a leaky rowboat, and I do a great job of getting in there and bailing it out. All my colleagues do a great job of doing that. They do a wonderful job. I have yet to meet a doctor, a nurse, a pharmacist, a physiotherapist, any healthcare professional who wakes up in the morning and says, I'm purposely not going to treat people correctly. I'm only going to treat 20% of my kids are going to get immunized in my practice. Or I'm going to purposefully or willfully neglect something. It doesn't happen. That's not the way we're trained. Yet, when you look at compliance rates, statistically, 30–40% of people have colorectal screening. 30–40% of people adhere to cholesterol medication or achieve the optimal result. Why is that? Because I can only influence people when they're sitting in front of me in my office, not when they leave. So it's particularly important that we get a different message out to folks. Now, why is this important? Reform is not about changing the process. Reform is not about changing the model. Reform is about changing the outcome. And reform is about changing the diskette that's in my head as a citizen of this country, what I need to do for myself. Because if I don't get it, if I don't do it, it's not going to happen. Okay? Now, keep in mind that 70% of chronic illness is driven by what? Lifestyle, not even my genes. My genes give me the roadmap, but if it's my lifestyle that's going to determine chronic illness. So here I am in the rowboat, and I'm bailing out the water, and I'm doing a great job. Okay? But there will come a point in time when I simply will not be able to keep up. And I am, you know, the proxy for the entire clinical professional world. Why? We can't train people fast enough. We can't build enough hospitals. We can't end up having enough ambulatory surgical centers. We cannot build enough infrastructure fast enough and pay for it all to deal with the oncoming clinical acuity that we're going to be hit with over the next few years. If you don't believe me, look at the obesification of America over the last 10, 20, 30 years. Look at the rate of diabetes in this country and in North America over the last 20 years. And I think the stat is 1 in 3 kids born after year 2000 will be diabetics by the time they're my age. You know, the incidence of diabetes today, roughly about 10%. It's probably a little lower than that. That's a pretty phenomenal stat. So, okay, what's this all about? And I will try to keep the rest of my comments very short because I know the more important part is you asking us some questions here. I think what it's all about is, what's it about for us, our model, if you like, what are we doing differently that we need to think about as a model? First of all, the thing that we absolutely are doing differently is understand who has the risk and get the information to that person in a way that they understand it. And what does that mean? That's a personal health coaching model. That means people need to have someone they can dial up, not only their doctor, their doctor's office, because quite frankly, I had about 3,000 patients in my practice. I couldn't handle having 3,000 people call me repeatedly. Didn't have the time, the staff, or the ability to do it on my own. So we need a personal health coaching model, quite frankly, that gives people a clinical resource, number one. That person has to be trusted. Those individuals have to be trusted because they have to do a very important job. The second thing we need to do, quite frankly, and one thing that we do differently, is help people understand that when you answer some basic questions, the information is for you, not for anybody else. It's for you. And that helps you prioritize your risk with your personal health coach and your physician. The third is disseminate that information out to whom? To the individual and to their doctor, because sacrosanct is the doctor-patient relationship. Our position is enhance it. Enhance it by giving people information that they need on choice to determine what level of quality do they want, and those parameters should be uniform. Choice on what kind of procedure do they want. Why? Because the evidence says you could have one of 3 different procedures. So if you come to Dr. Gettas, you're going to get a particular procedure. If you go to Dr. Smith, you might get a different one. What is the right one for that person? Well, let's help them make that choice by giving them information. Transparency of choice when it gets right down to it. The third, quite frankly, is let's shift gears for a minute and talk about the sick, because we can't leave our eyes off the sick. Why? Because people will always get sick. You know, I'm going to have a midlife crisis and I'm going to rack my car up in a bridge somewhere. Unexpected illness. Or I'm going to follow everything my doctor said. I'm going to listen to my CIGNA health coach. I'm going to have done a health risk assessment. I'm profiled. I know what I need to do, and I'm going to be behaviorally ready to do what I need to do. But karma is karma. And at the end of the day, sometimes, even though I do everything correctly and everything is done the way it should have been done, bad results happen, because that's the way medical illness is. So we have to focus on the chronic wheel as well. And what we're talking about there is care coordination. So it's differences in the populations. It is risk profiling information. It is personal health coaching for the people who have the risk, who don't know it or don't want to face it. Why? Because it's not relevant to them. And it is care coordination for the folks who are chronically ill, who are acutely ill, who absolutely need to understand the best possible outcome for them and then achieve it for them. I've got a bunch of other stuff we could talk about, but quite frankly, I'm going to chew up all your time if I do that, and I don't intend to do that. So what I want to say to you is, the model from our perspective is engaging individuals in understanding their risk and doing something about their risk on their terms. And when you do that, you start to see objective changes in behavior. And we see that evidence occurring within our populations who've chosen CIGNA as their health insurance company, their health solutions company. And at the end of the day, when you do that, you affect the clinical outcomes. So our answer to Congress, quite frankly, is improve the clinical burden of society, and you've got the problem resolved.